COVID-19, the vaccines could be available for Americans as early as next month. The Food and Drug Administration Advisory Committee, they will meet on December 10th.
This is really potentially incredible news. So what does it mean for you? CBS 46's Melissa Stern spoke with the experts about the promising results of these worldwide trials.
With millions of people around the world infected with COVID-19.
We've passed a grim milestone in the last couple of days of 250,000 deaths in the United States from COVID.
Drug makers are offering a glimmer of hope, reporting vaccines with greater than 90% efficacy rates.
There are two vaccines that are really the front runners right now, and that's Pfizer and Moderna. Both of those vaccines are made by a new technology. This technology has never been in a licensed vaccine before.
Norman Baylor, the former director of the Food and Drug Administration's Office of Vaccine Research and Review, says these drug makers would be getting what's called an EUA.
It's not an approval at all. This is emergency use authorization where the FDA has reviewed the available data and made a decision that the benefit outweighs the risk.
Then the CDC will make recommendations on who will receive the vaccine first under the EUA.
It could be healthcare frontline health risk individuals, followed by high-risk individuals, such as those who are elderly or in nursing homes. So that hasn't been determined yet.
Then, the FDA will continue to review data to determine whether the vaccine should be licensed or not. The manufacturers say there will be a limited supply at first.
I mean, we need approximately 600 million doses in the United States. These vaccines are a two-dose series. So it's going to take time for the manufacturers to ramp up for that kind of supply.
Baylor says this process generally takes months, even years, but the pandemic has sped the process up in unprecedented ways.
When this vaccine first comes out, we will have to make sure that we continue to mask up, social distance, and all those things, because it's not going to be like you've heard flipping a switch.
He adds that it will be a progressive process.
If you're not in a high-risk group, you're not going to get the vaccine anyway until later on.
Melissa Stern, CBS 46 News.